Our names are Abby Moore and Molly Gilles. We are students from the University of Illinois Urbana-Champaign and are studying abroad at Gustolab International Food Systems and Sustainability in Rome, Italy. This video is created for our Food and Media course. The main purpose of this video is to provide information about the Sustainable Development Goal of overall good health and well-being.
My name is Molly Gilles and I'm from Washington, Illinois, a small town located in central Illinois. And Abby is from Wheaton, Illinois, a suburb of Chicago. We are both juniors majoring in communication.
Gustolab International Food Systems and Sustainability is a great program for studying abroad since it allows students to understand and learn about the Italian culture from a hands-on experience. Our assigned goal is to inform others on good health and well-being.
Good health and well-being focuses on the objective of ensuring healthy lives and promoting well-being for everyone at all ages.
That being said, we will now go into more depth about what good health and wellness is defined as.
Health is defined in the dictionary as the state of being free from injury in a person's mental or physical condition, while well-being can be defined as the state of being comfortable, healthy, or happy. This may sound like a simple definition, but there are actually many important components and aspects of these concepts that affect our lives and the population as a whole.
This Sustainable Development Goal is extremely important for many reasons. Making sure people live healthy lives and pay attention to how their actions affect their overall well-being is essential to sustainable development and, in specific, building prosperous societies. We have learned that a big part of why this is so important is the effect it has on the life expectancies.
There have been significant strides made in increasing life expectancy as well as reducing some of the common killers associated with child and maternal mortality. Some things that would help to even further improve life expectancy would be education on the risks of tobacco and more efficient technologies for clean fuel use during cooking.
Despite these great strides in improving health and well-being in recent years, there are still many inequalities in healthcare access. More than 6 million children still die before their 5th birthday each year. Children born into poverty are almost twice as likely to die before the age of 5 than those from wealthier families. This divide in the social class system should not be a direct correlation to the amount of healthcare available.
These statistics are extremely concerning and unfair. Epidemics such as HIV and AIDS are able to thrive in areas where people's ability to receive health services that they need are limited by fear and discrimination. It is not fair that the quality of healthcare or lack thereof depends on the wealth of an individual.
As of 2017, 36.9 million people were living with HIV and 1.8 million people were newly infected with HIV. These facts are even more concerning for women and adolescents.
Globally, adolescent girls and young women face gender-based inequalities, exclusion, discrimination, and violence, which put them at an increased risk of acquiring HIV. It's also very alarming that HIV is the leading cause of death for women of reproductive age worldwide.
With an issue this large and affecting this many people globally, there should most certainly be more awareness and prevention tips present. Focusing on women's maternal health, since 2000, maternal mortality has fallen by 37%. In some locations, such as Eastern Asia, Southern Asia, and Northern Africa, maternal mortality has declined by close to 2/3.
While these statistics may seem positive, the ratio of mothers that do not survive childbirth is still 14 times higher in developing regions rather than the developed regions. Only half of all women in developing regions have access to health care that they need.
It is extremely concerning that the demand for family planning is severely increasing at a rapid pace, but the need for it is only being met at a very slow pace. Studying abroad has given us both the opportunity to experience a completely new culture's sense of health and well-being.
The funding issue is a never-ending cycle of not enough money and providers in some areas and plenty of both in other areas. The Official Development Assistance, ODA for short, has increased by 41% since 2010. As of 2016, the basic health from donors was at $9.4 billion. This is a positive example of taking steps in the right direction to help improve everyone's overall health and well-being.
It is so common these days to hear about other parts of the world that are lacking access to safe and reliable health care. Fundraising and donations to help create better communities for those that are in need are crucial action steps that should be taken by everyone. Globally, there are so many changes that can be made to help improve the struggling conditions and poor statistics that we stated earlier.
Addressing the global health challenges can reach a wide range of people in all professional fields. Taking action and participating in making a change is more than just doctors and medicine.
For example, supply chain management, computer programming, architecture, education, communications, human resources management, and the list continues. Skills from all of these areas are needed to create a lasting impact on the world's health issue.
If people are looking to get started in how they can help make a change, we advise you to start learning more about specific areas that concern you the most. We then would recommend to look for service opportunities where you can volunteer, whether it be in your home country or while you're abroad. This will give you a taste of what working in this field is like and will show you how much assistance is truly needed to impact global health.
If you find that this is something that is calling your name, we suggest that you consider it for a full-time working position. Many organizations are looking for employees from all backgrounds, and having more diverse perspectives present will allow a more effective solution to be available.
We have a new appreciation for the healthcare we receive both at home and here in Italy that makes us able to live healthy lives and give attention to our well-being on a daily basis with little to no difficulty.
With our new knowledge on good health and well-being in our world, we have also learned different ways that we can contribute to achieve the 2030 goals of reducing the mortality rate, ending preventable deaths in newborns and children under the age of 5, and strengthen the prevention and treatment of substance abuse.
As with most cases, money is a big part of the issue. If we spent $1 billion in expanding immunization coverage against influenza, pneumonia, and other preventable diseases, we could save 1 million children's lives each year. In the past decade, improvements in health and healthcare led to a 24% increase in income growth in some of the poorest countries.
This may sound like a lot, but the cost of inaction is even greater. Millions of children will continue to die from preventable diseases. Women will die in pregnancy and childbirth, and healthcare costs will continue to plunge millions of people into poverty.
Non-communicable diseases alone will cost low and middle-income families or countries more than $7 trillion in the next 15 years. We can do so much better than this.
Not every solution is money-based, however. There are many things that can start as soon as today to make a difference in good health and well-being, ultimately to help the sustainability of our world as a whole.
We can start by promoting and protecting our own health and the health of those around us. Students can take this step before studying abroad. We can take the initiative to better inform ourselves about decisions we have in regards to our health in both the United States and here in Italy. We can also encourage those around us to make the same healthy decisions, as well as help them to make educated decisions such as practicing safe sex and vaccinating their children. We can also take this step after we return home from abroad, especially now that we will have a new, first-hand global perspective on health and well-being.
Another step that we can take towards reaching this goal is to work to raise awareness in our communities about the importance of good health, healthy lifestyles, and the right that people have to quality healthcare services. The more informed people are, the easier it is for them to make healthy choices that positively affect not only them, but the well-being of those around them. This can even be as simple as talking to a friend about everyday healthy habits that they can add into their daily routine.
Another great idea that can be put into place by study abroad students at home or in their country of study is to take action through schools, clubs, teams, and organizations to promote better health for all, especially for the most vulnerable groups we mentioned earlier, such as women and children. It is important to educate children on this matter because it will affect how they grow up practicing healthy habits, which will ultimately affect the well-being and health of the next generation.
Finally, you could hold your government, local leaders, and other decision makers accountable to their commitments and the current state of our world and community's healthcare and well-being. They have the power to make decisions to help improve people's access to healthcare and health overall.
For those who are unaware what studying abroad is, it is an opportunity for students to receive a global education and intercultural awareness building opportunities. It also allows students to encounter other cultures through a hands-on learning experience.
Studying abroad is an amazing opportunity to be able to make a difference in another community besides the country a student is from, and even just a small effort can make a world of difference.
To other study abroad students, we are calling on you to take action on this extremely important matter. We ask you to educate yourself. We have provided a lot of information in this video, but researching this topic on your own can help you to better understand how large the issue really is and how it can end up affecting you and those you love.
Students, during your time abroad, it is so important to keep an open mind and really pay attention to your surroundings. What would those surroundings look like with the particular changes in healthcare, health, and well-being? Then, go a step further and think of what you can start today to enforce positive changes and reduce the risk of negative changes.
We have the power to make a significant difference in our world, and the opportunity is even greater for those of us that are lucky enough to experience studying abroad. We should care about our own country's health issues as well as those in the country that is our home for the semester.
Upon returning from studying abroad, again look for connections, differences, and similarities between the U.S. and where you studied abroad. You may find that now you have an easier time generating ideas as to where you can specifically help in certain ways for each country. Share what you have learned with family and friends and emphasize to them the importance of good health and well-being.
It is so important that us as study abroad students use our amazing and rare opportunity to better our world and the lives of those around us. Thank you for taking the time today to listen to us speak about this extremely important matter.
We hope it has inspired you to learn more about good health and well-being in our world and what you can do to create a change.